Welcome to another episode of MyData Zurich. This is a short version of our full webinar. You can find a link to the full recording in the show notes below. This summary provides the key takeaways of our guest speaker Damian Page and his view on what the future might bring. Let's get into it.
What I've been trying to highlight here is really staying on a high level, that it's not so much data in itself. The digital world, it opens a lot of actually new ways to solve very analog problems, which is there's a physician and there's a patient. And if we manage to use digitalization and data science in healthcare, we have tremendous potential to have better, more personalized care, to have better health system efficiency, and for us as a research company, very important as well, we can have competitive, modern, data-driven biomedical research and development. We need that. In order to get there, we need to find a way how to generate and use continuously growing high-quality health data sets. This is what is required to realize the potential. We have so many different ideas. We can only realize the potential if we really focus on the patient, in order then to have a moonshot ambition where we want to bring our healthcare system to work together across interest groups, across different stakeholders, to achieve speaking with one voice and generate also a political will to advance the health system. I personally am an unfeigning optimist, and I think we can do better in Switzerland than what we have done so far. We can make a learning health system a clinical reality in Switzerland if we focus on infrastructure priorities, we set the right incentives. And here again, right incentives would mean we really need to incentivize primary data quality in order to use it for secondary use. And there is no way other than really working all together to gain the trust of each and every citizen, not just patients, each and every citizen. We can only do that if we work on having transparency and clarity on the data use. If we do all of this, I'm very optimistic that as a society, we can seize the opportunity of big data in health and medicine and make this a much more efficient and even cheaper system that we're running today. You know, I grew up in the Alps, and I'm a mountaineer, and you don't know where to go if you don't know where is actually, what peak do you want to go up. So the very first thing before to say where we want to be in 5 years, in 10 years, is we actually need to have a common understanding. Where do we want to go? We need to realize that what we're doing now is quite bad. Only the Americans pay more for health than we do. We can still afford to have a very inefficient system. And for me personally, this is actually a shame. So we need to have an ambition, and then you can very clearly map out what is step one to get there for a more efficient health system, a much higher ambition to really use digital technology to make more for patients, for health system efficiency. And if we want to continue being competitive in R&D in Switzerland, we actually need to change the system.